Again. So for this section of the GP Education website, I'm going to talk about atopic eczema in particular. So atopic eczema, it's of course one of the commonest diseases of dermatology, and it's seen a huge amount in pediatric dermatology. The large majority of patients will get symptoms and signs of it by age of 5 years old, and the severity of disease tends to get better with age. But you've still got to be aware that patients may still carry a lifelong sensitivity, so they might be particularly sensitive to irritants or chemicals and things like that. So it's important to remember, as it may predispose them to occupational skin diseases. For instance, if they are doing hairdressing or if they work in nursing and come in contact with a lot of chemicals or wet work. So the major associations with atopic eczema, as we all know, are asthma, hay fever, and food allergies. Food allergies being the least common of these. And you're also more prone to skin infections due to reduced cellular immunity found in this condition. So patients may be more prone to develop bacterial, fungal, and importantly to notice viral infections. So you can get a severe herpes simplex superinfection, which we'll go into detail later in this section. Just mention a thing called the atopic march. It refers to the natural history of atopic manifestations. So usually the young atopic population will present with eczema and food allergies, and these become less common with age. Then later, a few years later maybe, asthma will be kind of the main condition that they might present with. And again, this also becomes less common with time. Then in adults, the most likely thing that they may have would be allergic rhinitis. And recent literature supports the idea that there's actually a causal link between atopic dermatitis and developing these later atopic disorders. So it's postulated that the dysfunctional skin barrier can be a site for allergic desensitization to antigens. So basically, antigens that shouldn't get into the skin do get into the skin, and as a result, you get an abnormal immune response, which can lead to abnormal systemic immunity. This may predispose them to allergic nasal responses and airway hyperactivity in the future. So atopic dermatitis really is a clinical diagnosis. You know, once you've seen it a few times, you can almost immediately say what it is, and then as such, investigations are usually not needed. So it's a red scaly disease, and you often get these small little erosions within the lesions. Particularly in the younger age group, it can often be weeping and sometimes crusty, which might suggest secondary bacterial infection. And now, very important is it is a very itchy condition, and also the skin can be hyper irritable. So you know, things such as grass, wool, sand, all can irritate the skin and cause more scratching. So this is just broad strokes, but the pattern of eczema may vary with age. So in the infantile phase, the eczema often tends to affect the face. It can also affect the elbows and knee flexors. Trunk may be spared, but again, the whole body can't be affected. In the childhood phase, it tends to then localize a bit more to maybe the elbows, knees, wrists, ankles, and necks. And again, it's the flexural areas mostly affected. And at this stage, the child might begin rubbing a bit more, and you can get lichenification. And this lichenification is basically thick skin with exaggerated skin markings. And this can be a big problem, especially in the darker skin types. And oozing and crusting tend to be more prevalent in the above phases, so the infantile and childhood phase. And here's a picture of basically eczema affecting her in the flexural areas. So then in the adolescent phase, as they get a bit older, the eczema usually becomes a bit drier, but it can be, the lichenification can get a lot worse, as mentioned, particularly in darker skin types. And here's a good image of lichenification with exaggerated skin markings and the thickened skin. Then in the adult phase, again, the eczema can persist the way it is in the flexural areas and things, but also patients may, most of their eczema may go away, but they can develop a hand dermatitis. Here's just an image below of severe eczema in which the patient's been scratching in areas for ages and they've developed these prurigo nodules. And these, unfortunately, as you scratch away, the skin gets thicker, and also the itch fibers become more prominent, and so the itch gets worse. and as such, the itch gets worse. You scratch more, and this can be a self-perpetuating cycle. And oftentimes, you need a strong topical steroid, and you can use a dressing almost over this to occlude the steroid, which makes it penetrate deeper. So there's certain variants of eczema and atopic skin. So the image below shows discoid eczema, and it is quite a common variant of eczema. And you get these kind of almost more well-defined round patches of eczema, and these again can be very itchy, and you often need a potent topical steroid to get this under control. Pityriasis alba is another manifestation of atopic eczema, again often seen in younger people, and it's again especially in darker skin types. And as you can see, you get these hypopigmented areas, and they're slightly scaly, and you could easily be fooled that this is pityriasis versicolor, or even sometimes I know the few times I saw it, I was wondering could it be vitiligo, but usually a weak topical steroid will help this go away.